So we're here with Dr. Francis Sutter. He is the clinical professor of surgery at Jefferson Medical College and chief of cardiac surgery at Lankenau Medical Center in Philadelphia.
Correct.
So you were here today talking about and teaching robotic coronary bypass surgery. Can you tell us a little bit about the procedure?
Well, the procedure that I do is a specific one where we can get the arteries on the front of the heart, and the incision is about 1.5 inches. So there's 3 holes. 2 of them my little finger would not go into, and the other one is 1.5 inches. And we do bypass to the most important artery on the heart with the most important bypass graft, and it gives the best survival benefit. So when surgeons talk about bypass surgery, they usually say, well, as long as the internal mammary artery to the anterior descending artery, and what we do with the robot, is good, the patient will be fine. So we can do the most important part of the surgery, and the patient will do great. Now, many times, probably half the time I use the robot, I am doing an operation where I do part of the fixed part of the heart, and the cardiologist fixed the other part with stents. And it works very well. It's called a hybrid operation. And all in all, patients, they don't like the idea of having an incision through the middle of the chest. They'd rather have an incision this big. And a lot of them just flat out refuse to have this, even when they need it. So when we give them the option, it really makes a big difference.
So how long have you been using the DaVinci robot in your practice?
11 years.
11 years.
11 years.
So this is your favorite approach?
This is my favorite. I'm busy with it every day of the week, using this approach. And there's also, it's a different way to think about bypass surgery, because when we collaborate with cardiologists to use stents and do what I do, the most important part, that the longest lasting gives a survival benefit, and cardiologists can do the rest, it has the same outcomes as when we go this way without all the trauma. So when the average patient is 70 years old, if you hurt them so much, many times they don't ever get back to doing what they were doing before the surgery. They they can't do it because I hurt them too much. Or patients have sick and lots of organs that their kidneys don't work, their lungs don't work. They're in the hospital so long they barely make it because I hurt them too much. So I'm very aware of hurting the patient. And in addition, when we do this surgery, we do it with the heart beating. So not only do you eliminate this big long incision and breaking a bone, and for an incision like this, you do it with the heart beating. You don't put them on the heart-lung machine. You don't stop their heart. I mean, stopping the heart is who wants to have their heart stopped? Yeah. Nobody. So it eliminates a lot of the bad things about doing traditional surgery. I still do traditional surgery, but I'm a zealot for this procedure.
So have you been on the faculty of the Re-Evolution Conference before?
Yes, for I think 5 years maybe.
5 years now.
Yeah.
So tell us a little bit about your thoughts on the conference and its organization and how Dr. Ramchandani has put this conference together.
Mahesh has put this conference together and fine-tuned it so well over the years, because the major problem with surgery is you need to be able to put hands-on. You know, like we all do our residencies in heart surgery, and we learn traditional techniques. But when we have the newer techniques, you don't have the opportunity to have hands-on. So the huge benefit of this is we have an opportunity to use a cadaver so that the surgeons can really learn how to do these new techniques that are better for the patients. Because you can't do your first one on a live patient. It doesn't work out so well. So this is a great way to learn. Hands-on is the best way to learn, and that's why, most surgeons, they don't read books very well, but they know how to move their hands. And once you have tried it with your hands, it just sticks. It sticks in your brain, and you can do it. So when the surgeons leave here, many times they're ready to really move forward because they've had a taste of how the surgery really goes.
So tell us a little bit about your feelings about the facilities here and what has been made available for you here.
This facility is incredible. Like, I think it's like the seventh wonder of the world. It's so large, it has so much, it has everything. And I don't think there's a surgeon that comes in here that isn't overwhelmed at how great this facility is. It's unbelievable. What a great place for learning.
So maybe in conclusion, if you could take a couple of minutes and give us some of your views on the future of minimally invasive cardiac surgery.
Well, the future, I believe, is in the hands of the engineers. The engineers are so smart, and many of them are working with surgeons, but they're going to figure out, just like the cell phones, they went from big and clunky, doing one thing, to doing many things. And I think that the heart surgery of the future might not be the same as Star Wars, but it's going to be pretty close. And we're going to make smaller and smaller incisions and hurt the patient less and less, and we're going to have better outcomes for the patient. And that's where we're going, and that's the future.
Well, thank you, Dr. Sutter.